A very good afternoon to all the participants. We welcome you all for the final day, session 14 of the 5 days AICT Training and Learning Atal Academy sponsored online faculty development program on training for social connectedness and inspiration, organized by Department of Electronics and Communication Engineering, Sri Venkateswara College of Engineering, Bengaluru, Karnataka. For the day, today's session 14, we have a special resource person again, Dr.Somashekar.A.R, MBBS, DCH, DNB Fellow in Respiratory Diseases from Singapore, Special Training Respiratory Disease at University of Illinois, Chicago, and Professor and Head of Pediatrics, Ramaya Medical College, Bengaluru. First of all, on behalf of management, principal, and from the head of the Department of Electronics and Communication Engineering, we would like to welcome Dr. Somashekar sir once again for session 14, sir. We would like to welcome sir.
We'll start the session.
Yes, sir. Now I request sir to take over the session. So please.
Am I audible?
Yes, sir. Yes.
Thank you. Again, I welcome you all for this forum on health education. And outside, I thank Shri Muniappaji, patron of Shri Venkateswara Institute of Technology, and Dr. Shashidhar, and Dr. Suresh, coordinator Dr. Shivshankar, and Dr. Dilip, and my friend Dr. Shashid Sridhar, and all the faculties and the delegates in this forum. And this is the second session, and we are focusing on stress disorder and how it is affecting in this pandemic, maybe because of the illness or indirect influence of pandemic, global pandemic. Despite, and I bring warm greetings from my prestigious institute, Ramaya Medical College. Despite we understood a lot of about COVID pandemic, recent advances, pathology, physiology, various treatment modalities, and vaccines, everything we are speaking. And it is also affected directly, indirectly our education, economy, health, religion, transport, tourism, unemployment, entertainment, food, sports, everything. What by 2020, this end December, we are already in December, 132 million people are expected to be in the poverty line, and 3.3 billion global workers are under the risk of losing their livelihoods. Such a big statistics related to the sufferings. And what is an impact on this healthcare? It is because of the challenges in diagnosis, challenging in understanding what is quarantine, isolation, and other things. What is suspected and how to confirm the cases. If it is confirmed, where to admit, how to admit, where is the facilities, and if it is high dependency, where to take care of them. It has affected the existing medical system because we were not prepared, and many health problems are neglected because of the disease, like chronic underlying diseases were neglected, or underlying patients were neglected, and it has costed more than 600 healthcare professionals. We lost more than 600 doctors, many healthcare workers, and dissolved because of medical chain as disrupted. It's a cascade system. When the demand of services, supply services affected because of the movement restriction, lost income, concern about COVID-19, supplies, re-employment, morbidity, mortality of healthcare workers, and all these issues have affected the demand and the supply. There is a lot of disparity. What happens with economy? There's a poor cash flow and affected all kind of business, from petty business to international business, affecting the chain, affecting the goods, and overall affected the growth. You see, this is the growth in the pre-corona era and corona era where India stands. Definitely, it has affected the growth. After knowing the growth and what happened with the society, stress among the population because of the disease, directly or indirectly due to other issues, and affected the sports, tournaments, social sector, education, travels, festive, everything, as well as affected the day-to-day activities, uh, theaters, sports, clubs, gymnasiums. Exams are postponed, exams are affected, scholastic learning is affected. It had affected the family relationship and other things indirectly. Because of this, 1.6 billion students are out of school, and there is 30% minus 30% investment in clean energy power transition. Of course, there is positive impact of clean air pollution and pollutants. This has been very well reported because all the rare species have come out and they are breeding. The waters were clean, roads were clean, pollutants were reduced both in all the major urban cities. It has pushed by 2030 113 million to be in the poverty line. So, what's affecting overall directly and indirectly? It is leading to stress disorder. What is the statistics says? Recent statistics for 130, 234 responded that has showed 82% of them had mild of respiratory illness like a breathing related issues, sweating, nausea, and other thing. 64 felt nothing has happened, and 25% that post traumatic stress was affected, like in their behavior, loss of memory, or anxiety, and 55% of troubled sleeping or lack of sleep, and 65% they also some amount of experience and jumpy and easily started quite unrelated related behavioral issues. So by July 2020, we are seeing 53% being affected mental issues. Overall, what's affecting? Warning signs of stress is it has affects the both body and mind. It is a holistic stress. What is happening with the body? They're getting frequent headache, body ache, muscle twitches, fatigue, skin irritation, and breathlessness because of the stress, not because of the disease. What I'm talking. And what happened with the mind? Mind is little worried, muddled with thinking, impaired judgment, nightmares, indecisions, negativity, and hasty decisions. The mind. Coming to the behavior, they're prone for accident because of the judgment, loss of appetite, and loss of sex drive, drinking, abuse, alcoholism, insomnia, restlessness, smoking, and coming to the emotions, loss of confidence, irritability, depression, apathy, and apprehension. What is COVID stress disorder or post traumatic stress disorder? So, all stress is a mental health problem which includes anxiety and depression, either because of the suffered or because of the family member in being suffered, or they have witnessed a death with a kith and kin, or fear of death, or because of the overall the factors influencing the stress like economical or the poverty or other financial crisis, leading to also adding to that other factors are predisposing factor or the causal factors. If we take is a social isolation, stigma, unemployment, separation from the family, and especially for health workers it is a fear of exposure, burnout, frustration in case of treatment failure, and with the best efforts also, and social agitation. What we should do? What are the protective factors? If we take, it is the social support, financial stabilities to improve, healthcare resources, safe workplace, wellness program can be started with adequate personal protection and timely COVID testing. These are the factors. It's all social factors rather than the emotional factors where you can give the testing should be done, PPE can be given, safe practices, safe workplace, safe schooling. All those things are the very good protective factors to be applied. But what CDC says, what is stress disorder? What's happening with the population behavior? Trauma and stress related disorders has raised to 26.3% increase, anxiety and depression to 30.9%, substance abuse to 13%, and suicidal ideation to 10%. See that increase in the number of cases with the suicidal ideation to 10%, abuse have increased, depression increased to 30%, and trauma and stress related to 26.3%. Coming to the focusing on mainly on adolescent, what they undergo? They undergo a lot of stressful life events, and indirectly because of the home confinement, grief because of the death or witness death, or if there is a problematic family, they undergo the are witnessing or being part of violence and worries of social media or the gadgets. What Indian studies says that psychiatric morbidity is reached to 31%, and global prevalence of stress has reached to 45%, and high number, mainly the high number of depressive symptoms, which is leading to all the calamities. These are all the statistics related to the stress. Statistics: depression has increased, accident, suicidal ideation has increased, and the factors influencing these things we understood. But challenge is adolescence itself is a challenge, and because their frontal cortex will be growing, lot of hormonal imbalances, and judgment problem will be there. It is a very good challenge to treat them or understand them or to see the response with them. And they'll have underlying environmental factors, genetic factors will be playing for their whatever they are undergoing with the stress. So they are vulnerable. As I mentioned already, ongoing brain development, the frontal cortex till 21 years, increases to cortex, leading to vulnerability to the diseases as well as increases the stress-related activity. If you rule out other simple factors, it is mainly they lose their self-esteem, affecting their relationship, and do a lot of depression, peer pressure, abuse, and other things. Small factors, even other factors can influence, like financial or scholarship backwardness, or no contact classes, assignments, or not understanding everything I do. Mainly their self-esteem being affected, and other factors like depression and peer pressure. Can we have some toolkit to understand them? We should have a checklist. Before that, we should understand the situation, what's happening. We should understand their lifestyle. We should understand their immunity, and we should know what's the stressful situation they're undergoing. Important thing is we should focus on their diet. We should focus on their diet, what they're eating, give a good nutrition food. We are talking in COVID times about good nutrition, kashaya to everything, so multivitamin. That's why we are talking about vitamin C, zinc, everything. We have got all in our natural food. Please focus on that, not to encourage the artificial foods. And good sleep is important. And even with the constrainment social norms, they can do whatever their physical activity, yoga, skipping, climbing up and down stairs, sport jogging, online fitness classes they can do, because they should keep themselves fit. Otherwise, that lead to isolation, sitting in one corner a long time leads to obesity and related issues, as well as lead to other psychosomatic disorders. And one more thing, as I mentioned previously on gadgets, a lot of negative news are there about death, fear, anxiety related to so many social platforms are giving false messages. They should rely on website of Government of India, WHO, and UNICEF, that they should restrict themselves. And what important is devices should be used properly. Devices should be important thing is it is affected their sleep, food, communication, and important the family should have whatever the policy related to the gadget or screening hours. They should, while having food or in the bedroom, they should not keep any gadgets set, and devices should be switched off 1 hour before sleep, and we should limit ourselves. We should be a role model before telling an adolescent. Apart from that, nutrition and the sleep, we should encourage them up. Yoga and meditation, we'll come to know what's yoga we are meaning. Important thing, the good exercise is to overcome the stress. What they have done, a lot of studies is deep abdominal exercise, hold the breath for some time in abdominal breathing, slowly release with exhalation. That has showed, even in Bastrika, that has showed with a good positive reinforcement. And and they are done even biochemical relation to this diabetic deep breathing exercise that has shown a lot of inflammatory mediators up and down. And nimansyoga.com, they can log in and understand. I already mentioned about media, and I mentioned about nutrition, mentioned about deep breathing exercises, sleep, and we should teach them skills because they are undergoing a lot of stress related to COVID, related to at personal level, family level, social level, at education level. We should teach them the simple problem solving solution, either with a simple enact, simple situation, how to solve it, or section wise solving, or how it strategies to overcome this positive the stress or the problem, and how to overcome for a better long time at the personal level, at the family level, at the peer level, how to solve it, how to overcome it, how to say yes, how to say no, how to come out of the situation. All those things we should be taught. That's very important rather than directly leading into the diagnosing a problem of depression or of ideation, rather than teach them about the skills of solving, creative thinking, critical analysis, problem solving. That makes a big difference in understanding. The important thing is stay connected with them. Don't leave them isolated. Teach them about the skills of speaking to the grandparents, the neighbors, and the friends. How to how to understand them, how to love, how to have a peace ourselves, how to develop the skill of overcoming the barriers, how to take confidence, how to help them treat important. Because it is not that we should be socially isolated. It is only the physical distancing what we are talking, not the social isolation. It helps not only the adolescent, with the complete family. Once again, when you're at home, be safe, keep the distance, don't go out, all these things out. But we should also get into the skills of managing the stress by writing a letter, reading a book, online chat, or phone a friend. Talk loud. As I mentioned, take deep breaths to handle the stress. Progressive muscle relaxation, just tighten the muscles of all the parts of the body. Give a command to the each muscles, each organ, each joints, and slowly command. Tell that positive, give the positive reinforcement to the system about slow relaxation exercise. Slowly release the system or the joint or the muscle. Slowly give a command, slowly relax, and feel the difference. Feel the healthy nature of acknowledge them. That is the progressive muscle relaxation. Break the task into smaller way. The big problem can be approached in a stepwise manner. Already mentioned of good sleep. Avoid overcome the energy drink, unnecessary artificial food. Identify your own strength. Maybe you're good at writing skills or a painting or making a sculpture. Get into that. Once again, reinforce on meditation and yoga. These are all the checklist on coping with stress. Talk to the family. This is the best time to increase the bonding, family bonding. Maintain your routines properly. Focus on the positive activities, maybe gardening or making the room garden or growing some plants, growing your own veggies, and as well as can reinforce your own feelings. Talk to your friends, express your love, happiness, have a good healthy lifestyle. Don't go for abuse. And important is your media should be good, your social platform is good, your digital wall should be good. See to that nothing has affected your digital wall, so that it will be in the future, it will reflect on your personality. Be careful with that and have good social practice like hand washing to social norms. Important word is on suicidality, which we are seeing in so many platforms, right? From celebrities, so many cases we are seeing. Let us not got affected. Maybe they got underlying a lot of causes. Let us not take them as an example. Maybe they have got underlying disorder which was not addressed properly. But what children are, what adolescents, let us understand what are the warning signals. What are the risk factors? Previous suicide attempts, presence of psychiatric disorder, if they are substance abuse, more alcoholic or smokers or drug abuse, If there is a family history of suicide or any chronic physical terminal illness, there are the warning signs. Other risk factors are any acute grief is going on, or anxiousness, agitated, anger, or if he's feeling isolated, hopelessness, worthlessness, repeatedly telling about suicidal ideation, undergoing a lot of mood swings, overeating or undereating, affecting sleep, they're all the warning signals. That is the time you should assess them something is going wrong. That is the time you should identify the problem, report to the health worker, or take the help of psychiatrist. That's very important when you addressing a suicidal ideation. But when you're handling a grief or helping people solve the problem, just handling grief very important. Have understand the emotion, understand the situation, use the proper word, be genuine, don't judge anything, take the help of others. As I mentioned, important thing what we should teach the children is problem solving, section wise problem, step wise problem solving, identify the problem, discuss with other, take the help of others. There's nothing we can solve. We can solve all the problems. Give ratio, peace, be next to them. They should get a sense of belonging with you. Help them to solve the problem. That itself, they'll overcome the whatever the acute grief they're undergoing. But if you're undergoing, if you want to break the news of failure or a death or anything, be careful. Once again, be honest. Use simple words. Be frank enough to express it. Take the help of elders or a teacher or a mentor, and you be a balanced teacher so that they have empathy and shoulder for their whatever the acute grief they are going on. If he's agitated person, if you're handling, take care of your safety. Maintain the distance. Call for the help. Don't confront yourself. And use proper words so that it will not increase the agitation or whatever it is. After understanding few on depression, anxiety, suicidal ideation, handling the adolescent with the anxiety, behavior, anger, or if you want to open a bad news, few tips on that. Let us understand few terminologies being used: quarantine, isolation, social distancing. All are meant to avoid transmission so that we should reduce the risk of them infecting each other. But what happens with this? They also undergo some amount of mental health issues, as I mentioned, because of the illness related, or because of the isolation, or because of the lack of information, lack of nutrition, lack of social support, lack of friends. They undergo a lot of psychotrophies. Not only that, during COVID, in quarantine, if they doesn't get proper isolation, because of the isolation, they may undergo a lot of psychological issues, undernutrition. Also, post-COVID, they may undergo severe immune deficiency. So that's why we should maintain the quarantine or social norms of isolation, because even in after the COVID being affected, because of the immune suppression of Th1, Th2 cell affecting the cell-mediated immunity, they are prone for chronic contagious diseases like tuberculosis and other things. So we should be very careful. Go for very good is nutrition. Already mentioned repeatedly, taking up zinc or vitamin C. Maybe go for, rather than the medication, natural food products. These are all the overall well-being we spoke on during the pandemic, because of the quarantine, because of the isolation, because of the financial crisis, because of the economical instability, or because of the family conflict, because of the isolation, because of the undernutrition. They may undergo stress, anxiety, or behavioral disorders, and behavioral disorder or emotional disorders. So this is the time After understanding that, how to overcome this one, like at family level, personal level, or from the society, are handling this individual situation like with the warning signals, handling the grief, handling the anger person. We should overall know about general measures for well-being in COVID. That is wellness of body, wellness of mind, wellness of emotion, wellness of ecosystem, harmony within being. What is this body? I already mentioned about good sleep, already mentioned good nutrition, has meant physical activity, yoga, meditation, everything was mentioned. But when you are suffering, we should think of always a prevention is important. Keep social distancing. Every slide I'd like to mention about hand, personal hygiene, social hygiene, there's a true vaccine. Take early reporting is important, early medication is important. And if you are suffering from a respiratory illness, go for chest physiotherapy or chest activity, chest related exercise. Important thing is post COVID care is important. When you suffer from a COVID, don't stop at one level. Once you recover, please report to your doctor because some amount of other issues are cropping up like cardiac, neurological, or psychological issues should be reported to post COVID clinic. What is wellness of mind? Lot of literatures being studied from either Nimans or well-known centers or Vyasa. The meditation has led to a lot of inflammatory markers have come down, hormonal balances are good, endorphins are released, mind, body, soul has relaxed, and it has their influence on various organs been studied very well with positive reinforcement, and on maintenance of blood pressure or inflammatory mediators, even in yoga. So definitely we should focus or encourage on meditation. Meditation is nothing related to religion. Meditation is just a awareness of your truth. Concentrate on whatever the object you want to. Surrender yourself to the situation for 15 to half an hour every day, more than enough. It makes a big. It helps in your physical status, mental status, or whatever the relationship you are. It affects the family relationship, personal relationships, society norms, everything. Yoga, plenty of research throughout world is there on effect of yoga. We did research on effect of pranayama on asthma that has given a very good results in children with improved in lung functions, decrease in incidence of asthma, decrease in exacerbation, or decrease in use of medications. It's not only sitting and doing meditation or yoga. Even you can have a lot of activity, or your love towards sports, literature, art also is nothing but a meditation. That what if you love that object or the subject and surrender yourself, completely involve yourself, that itself is meditation. Especially yoga and COVID, there's seen very good outcomes in chest related improvement, cardiac output, and emotional distress has been decreased because of the yoga during COVID-19 times. So they're very good researchers there. That's why tele-yoga has been offered from NIMS. Already I mentioned about emotional well-being, like problem solving and everything. Speak to. It is not only the doctors should. We have a counseling centers, many counseling centers that they're helping for the psychiatric related counseling. But we should. This is the time we should not become agitated. A lot of a crisis is going on, as I mentioned, financial to emotional crisis. That is the time we should know the situation is like that. We should help each other for healthy interpersonal or social relationship that maintains good emotions. It is not only the mind, body, spirituality. It is once again have a good personal maintenance of the indoor allergen, indoor infections, outdoor allergen, or whatever the health policies. We should support the supportive social structure. The public health care workers are doing a lot of job, but what I'm seeing, this stress or the depression or other psychiatric system or the physical illness are being underdiagnosed or underestimated. What we are seeing, the tips of iceberg. So we should know how to identify the problem, what's going on with our surroundings, and early reporting makes a big difference. It is not only the early reporting, early referral is so important. Make sure that they take the medication properly, they undergo proper examination, and proper follow-up is also important. One more added problem to our society is the stigma. When a COVID is a whole family is abandoned, the person is abandoned, we look them in very bad way, we connect them into the racial issues, and the health professionals are seen in a bad way. For an example, we saw like a health work a professional doctor died because of the COVID, and community denied his burial in their locality because thinking it's a COVID. So that's the ignorance going on, and what will affect when the medical professional has been affected. What happens in the society? Good science or good health education makes our responsibilities to clear our doubts related to this. Important thing is social stigma should go. It is only what we are talking about social distancing, not to attach with stigma or discrimination. How to deal with stigma is stop using chiwans, wans, virus, avoid discrimination. Use of words are important. Maybe is suspected that they are on treatment. That's important. Start spreading the rumors. But hey, this fellow has got, that fellow got. He also has become positive. I was telling like that. Stop using these negative words. And false propagation should be avoided. Good thing is talk very good information about disease and distancing. Talk about people with who are all recovered legendaries or the scientists or your family members who are recovered. Give them the example. Tell them how the disease being spread. Talk positively about situation. Preventive measures should be reinforced. Misconceptions should be avoided. Support the frontline worker. As well as what is the role of digital? I was telling a word of social media necessary, but here we can use the best utilizers utilizer of our digital platform, especially few apps are there where they give about health records, maintenance of saturation, blood pressure, respiratory rate, about awareness, checklist, training, about the exercises. So many multimedias are there that can be best utilized during this time. Karnataka and Indian Academy of Pediatrics, Karnataka State Branch has given few guidelines for educational institution. I think all the institutions are following. They have from the government, but just to reinforce them, during transportation, students avoid common transport. Testing of driver is important. Spaced sitting. In the institute, have a multiple breaks and shifted based classes, and mm, both offline and online can be used, and monitor the social distancing based surveillance and make sure that safety measure not compromise with mask, face shield, and other things. Best thing is avoid overcrowding. Usually happens during the breaks on the food. It should be institution policy to have a everyday orientation on the health safety and with a checklist. There are so many triage forms are there, checklists are there to assess the suspected or if they are confirmed on clinical situation, how to see the mild, moderate, severe, how to isolate and everything. When it comes, always 6 feet distance should be maintained, hands should be washed, mask is a mandatory. Without mask, no discussion should occur. But it is bathroom should be shared, but make sure that it is properly sanitized. Classroom is properly sanitized. Avoid placing your personal items on the desk. Skip the seats or the rows to create a physical distance properly. Dining halls should be properly maintained and not to share the food. And utensils should be properly cleaned. Laundry, if it's hostel, take care and clean the disinfectant services that have been used with a proper manner, and mask should be discarded as per the guidelines. CDC, government, if you go, they give the very good guidelines. So many protocols are there. Recent one, just follow. And patient with either suspected or proved, if they're suspected, if a patient comes to you or a child or adolescent comes to you with a suspected respiratory infection or acute fever, isolate them first, inform the parents, and just if this progressive symptom, do the COVID test within 4 to 5 days. If it is positive, you report to the healthcare worker or the primary health center, they'll do the further needful. If it is a suspected negative, still keep them 14 days of quarantine, and no need to repeat the test as such. If they are doing good, there is no symptom, no need to do the test. Don't neglect any symptom, because the COVID is not related to fever, cough, fatigue. Any physical symptoms, give the importance and suspect it as COVID. Few question if you ask, if what happens, what to do? Like, we always come to institute with cough and cold, definitely should be isolated. Maybe just ask about where he has come, or containment zone, or family members being affected. Quarantine them for 14 days. Meantime, test for the COVID test, and depending on the positivity, take a call on the treatment. And unless you have got a crowded or exam related issues, RT-PCR on 14 days is not mandatory right now. If you do also, no issues about that. Already I mentioned about asymptomatic. It is not that only symptom, even symptom asymptomatic. Keep a triage or a track of all the students every day. If there is a, it is not only based on the symptom or positive or negative, even the asymptomatic carrier may be there. Maybe they're exposed to one of the family member. Please treat, just keep a watch, and if they develop any symptoms, just do the COVID test, RT-PCR, and take a call on that. Even if they are suspected or family member, isolate them for some time, watch for their symptoms. Results either positive, is suspected also to be isolated better, and even the positive as per the government norms. Much talked of is about the vaccine. Definitely it's nearby, it is safe. Multiple companies have come. All are safe, all are good. After a second year, the vaccine definitely increases the antibody production. It is with the government and public participation. It will be a big drive, big task for the government. Please help them to do the needful. Please cooperate with this thing. Definitely it is going to, it's one of the biggest revolution in this century of the vaccine drive. It's one of the safe vaccine. Little fever and mild will be that is acceptable, because the advantage is more than anything. Even it is given for the healthcare worker, then all the sectors are addressed. Even in diabetic or those patients suffering with chronic illness or debilitated, compromised, everybody can be taken. It is the vaccine is got one role, good, but we should never forget about our social responsibility. The social vaccine is very important. That is cleaning hands, covering the nose, mouth when coughing, sneezing with a tissue or flexible bow, wearing protective mask is very important, and avoid hugging, kissing, animal contact, or close contact with anyone with cold and flu-like symptoms. Just today, I addressed few things on our what are the lifestyle it has affected, what are the physical problems we are undergoing, what are the mental issues are undergoing, what is that adolescents are undergoing, how to handle, how to see the warning signals, what are the checklist, how to handle them, how best early to report, overall well-being on the emotions, on the physical well-being, something on yoga, meditation, art of living. Also address few guidelines on the for the school authorities. Reinforce the all we all know about this. Just reinforce from the health background about the vaccine. Finally, about social vaccine. That ends my talk today. But if you have any questions, queries, please report to the organizer. Ready to help at any time. Thanks for the opportunity. Thank you all. Stay safe, stay healthy. Thank you.
Thank you, sir.
Sir,
Thank you, sir. We would like to thank Dr. Somashekar, sir. In spite of his busy schedule, generally getting an appointment to the doctors only in normal time, it will be very difficult. But still during this pandemic situation, we got an opportunity to interact with you, sir, and we got so many useful information and how we should be behave and how we can manage our stress during these pandemic situations and all. So thank you very much, sir, for your kind information, sir.
Any questions?
Yes, sir. Some questions are there. Sir, what should people do to avoid having pneumonia due to corona? Kindly guide us.
Pneumonia, once again, this whatever the social norms are there, no, please follow. Especially if anybody has got cough-like symptom, be away from that. Use the mask because it's a airborne infection. Pneumonia is a airborne infection. Please wear the mask. Have the cough rules in the public, very important. And if is a aged person or younger children's, vaccinations are there, like influenza vaccine, pneumococcal vaccine. Please cover themselves. All those things are very important, but avoiding the infection is more and more important. Avoid this simple principle that will help them. One is good nutrition, cough rules, and immunization.
Oh, thanks, sir. And one more question. Uh, People who are recovering without medicine need to eat medicine.
That's a tricky question. If they are not treated, please, we don't know what happened with their internal organs. Please ask them to recheck once again. Have the minimal test. We have inflammatory markers in the body that can be checked. That tells whether they are going ongoing disease or they have got a natural recovery. So better go for a test or take the healthcare worker.
Okay, sir. And what are the precautions, actions need to be taken, sir? Once a COVID patient has been treated completely, means if he get a negative after treating the COVID patient, and what are the precautive measurements he has to take, and how many duration he has to take, and also.
No, precaution is once he is negative, not to worry. But once he is being treated, he should be isolated at least minimum 40 days, and we should undergo few tests are there. It is not the COVID test, other tests we do. Inflammatory marker, if it is within limit, it is for his safety. He will not spread, but is for his safety, he should know. And he should attend the post-COVID clinic. Post-COVID clinic, they'll check his cardiac status, lung status, neurological status, his exercise capacity. And depending on the doctor certification, he can do the needful.
Okay. Thank you, sir.
what is the
And once again, we should not think that he is out of danger. He is also prone for once again reinfection. He should take care of it.
And with what percentage that vaccine will be working? So now, whatever the vaccines now they're ready to come into the market. So, what is the percentage of guarantee that we can get cured completely, sir?
Vaccines, sir.
Yes, sir.
Vaccines definitely what they say is 90 to 95%. Very good. In any vaccine, we don't say more than 70%. See, vaccines doesn't cure the disease. Never. Not even any vaccine never cure the disease. It is all the myth. It avoids a complication. No vaccines cure the disease, right from our BCG to any this thing. All the efficacy or protective factors is around 70 to 80%. But what is the good factor about any vaccine is why we give vaccines to avoid the complications.
Yes, yes.
how many doses we have to take?
And how many doses we need to take, sir?
Two
Probably
doses. Two doses.
doses. Yes. And
They
now
may give,
one more.
depending on the government policy, they give within a month or 3 weeks, depending.
So there is one more question, sir. Now from participant Archana. Sir, is it okay if we send children for playing, taking proper precautions?
Please send them. Please send them. But make sure that like an adult should be careful. It is not the children who infect badly. The adults only come and contact with the children. they may transmit. Once the children get, they transmit badly to the adults also. Take care of safety measures, allow them,
No.
and make
This
sure
is
that if anybody, any child has got any symptoms, isolate them.
okay. Thank you. And this is a kind request to all the participants. We have given a feedback for the session 13 and 14, and final feedback also we have posted the links, and also the assessment test which you need to be undergone, that has been posted in the link. And we request all the participants kindly go through all the assessments, and it will be enabled for 24 hours from right now. Okay, and we request all the participants, you please log into Atal portal and you need to give a feedback and assessment for that. Okay, so this is a kind request for all the participants. Sir, one more question, sir. What are all the home remedies to be used for this corona?
Home remedies, once again, what I'm telling is hand hygiene, cough
Yes.
rules, social distancing is the home remedy. But what they are asking is about what are the homemade kashaya or whatever it is. See, if you take our Indian food, it contains all kind of this thing. Our sambar, if you take, they have curry leaves, they have chekke, they have lavanga, they have menasu, jeerige, everything is there. So all the kashayas are prepared from there only. So that is more than enough. But maintaining good, our potable water should be good. Better to boil it and drink. Good nutrition, good sleep is a home remedies.
And how many, what is the effect of this steam, sir? How many days and how many times we need
Definitely,
to
it is not that every time we should take. When you have that symptoms of upper respiratory obstruction, you should take. Otherwise, it's no use.
Thank you, sir. We got again, once again, a very nice feedback for you, sir. Thank you very much, sir. It was very informative, very effective and informative, sir. Thank you, sir. Nice session, sir. Thank you. And thank you, sir. Like this, we got very nice feedback for you, sir.
Thank you.
Thanks.
Thanks for the opportunity.
Yes. And from the management and from the entire SVC fraternity, we wholeheartedly thank you, sir, for accepting our invitation and gracing this event in spite of this busy schedule, sir. Thank you,
Thanks to
sir.
your chairman, your institute principal, faculty, and my friends either to organize this. Thank you, sir.
Yes.
Thank you all. And look for more participation. Thank you.
Yes, thank you, sir. And this is a kind notification for the participants. A validatory session will be there in the at 2 o'clock. So we request all the participants kindly join for the validatory. And there also we are going to post the final feedback and assessment test links will be given. So we request all the participants kindly go through those assessments and feedbacks. And once again, I request all the participants, please log into your Adult portal and you need to give the feedback to receive the certificate. It's a mandatory from the AICTE rules and regulations. Thank you, sir.
Thank you, sir.
Thank you so much, sir.
Thank you very much, sir. Thank you, sir.
Thank you, sir.